Happy Sunday, everyone, and welcome to Always Accurate Weekly with Hope Murray. Today, we're kicking off our segment, Navigating These Unprecedented Times with COVID-19. My guest today is Dr. Andrena Zeigler. Dr. Zeigler is a doctor of nursing practice, an advanced practice registered nurse, and certified pediatric nurse practitioner. Dr. Zeigler, welcome, and thank you so much for joining me. How are you?
I am well. Thank you so much for having me. How are you?
I'm doing very well. Thanks for asking. It is truly an honor and a pleasure. As I mentioned, we're going to be discussing navigating through these unprecedented times with COVID-19. Can you enlighten us on the virus and how we can stay safe?
Yes. So it has been unprecedented times. Coronavirus has affected us in so many ways. So it depends on, of course, the symptomology. It affects different people in different ways. You can be asymptomatic, no symptoms at all, and unfortunately, all the way to death. So we want to stay as safe as possible and prevent exposure to the virus. And so the CDC guidelines that were first given to us in the beginning are the way to still go. So we want to practice good hygiene. That means good hand washing. That means wiping down surfaces. That means social distancing. So if you are sick, you want to stay home. That means no school. That means no work. That means no shopping. So you stay home. And if your symptoms start to progress, then you want to contact your healthcare provider. Social distancing also means you do not socialize in large crowds. You minimize as many people as possible that you're exposed to. If you are around other people, then you want to stay at least 6 feet apart. And then lastly, you want to wear your mask.
Good stuff, good stuff, good stuff. You know, we hear a lot of them on the news outlets, on the radio, you know, on our jobs about 6 feet, you know, and washing our hands. And we wonder if it's really working. So it's good to hear it reiterated even from the healthcare field, you know. So thank you so much for that information. I did field a few questions from Facebook that we want to ask. So I have 4 for you. So my first question for you is explain how the mask is helping beat the spread of COVID-19.
So we know that coronavirus is a respiratory illness. It spreads through the respiratory tract. And so we emit respiratory droplets and aerosols when we talk, when we breathe, when we sing, when we laugh. And so in order to prevent the spread of those droplets, we wear a face covering. That's to prevent, of course, putting it out there into the air, but it also prevents you inhaling it. And we know that's how coronavirus gets into the body and causes illness. And so we breathe it in through our nose and through our mouth. Now, the mask is only going to be as good as the user. So you want to make sure that you effectively wear your mask by covering your nose and your mouth.
Okay, very good, very good. Do you recommend that people get the vaccine? That's the second question. And if so, what age range?
Short answer to that is yes, it is recommended. We know that vaccines in the past is proven to be effective as well as safe. And so the age ranges now for the 2 vaccines that are currently out there, Pfizer and Moderna. Pfizer is age 16 and above, Moderna 18 and above.
Now that's good information. I'm not even sure I ever heard that, and I kind of keep track with the news. So you said Pfizer 16 and above.
16.
Is 16 age, right? And Moderna 18 and above. Okay, very good information. So what if someone who didn't know that before get to a site with their 15-year-old child?
Right.
Would they reject that?
Yes. So we have to follow, of course, the age recommendations for these vaccines, mainly because of how studies have been conducted. So we want to make sure we stay within the guidelines. So I would ask that parents please contact your healthcare provider to find out if they first have the vaccine, but then secondly, which type. And if they don't have it, then to refer you to a place that may.
Okay, good. And that segues us into our third question. Since the vaccine is so new, why should people feel okay taking it?
So I do understand everybody's worries anxiety towards the newness of this vaccine. And please be reassured that although the vaccine itself is new, the science and research behind it is not. We have already been exposed to coronaviruses in the past that have caused outbreaks, particularly SARS and MERS in the past. We are not new to making vaccines, so this technology, is something that the healthcare field is good at. So we've seen in the past with those other vaccines that we have been privy to that they have been safe and effective. So we have no worries with this one, especially since the research that was conducted with this particular or these vaccines have shown that they are safe and they are effective. So there's minimal side effects that have been seen, and it's really similar to the side effects that we've seen in other vaccines. So that we've seen localized redness, swelling, little pain in the site, to sometimes fatigue, fever, headache, joint pain. But all of those things that happen, although there are side effects, they are also signs that the immune system in the body has taken that vaccine and is doing what it needs to do with it.
Okay, I am learning a lot, and that's just the third question. So let's get to the fourth one. Should we be concerned about the minimal spread that is happening amongst our children in the school setting?
So it's very good that our children don't show the same signs and symptoms, of course, as the adults do. We're very fortunate in that most of them are asymptomatic if they have the disease or have minimal symptoms. In rarity, we see this multi-system inflammation thing that happens in children, but it is rare. So of course, we still are concerned about the spread, mainly because they become little vectors or carriers of the virus. And then once they get in contact, of course, with another adult, maybe their grandparents or their family members, then the virus continues to spread.
Good. Thank you so much. Do you have anything else you would like to say in closing? That's all I have by way of questions. Do you have anything else you want to say in your final remarks?
Thank you again for having me, and I would say to everybody, please do your research. I know that there's a lot of conspiracy theories that's going around and some misinformation, but ask your healthcare provider. Hopefully you have a relationship with that particular person that you can get some trustworthy information.
Good. Dr. Zeigler, it's so hard for me to not call you by your first name since there's a personal relationship there, but I want to be respectful. Dr. Zeigler, thank you so much for your time and your willingness to join me. I appreciate you. I want to make sure I say that. And thank you to all of you who've taken the time to tune in today. So in closing, I want to say, please take time to like, share, subscribe, and follow us on Facebook. You can also visit our website at alwaysaccuratephotography.com. And lastly, check out our Always Accurate Smart Home and Networking with Dwayne. That's another weekly segment that we have. And should you have any additional questions about this particular segment or any other services we offer, be sure to email us, and our email address will be listed below. You guys stay safe and take care of each other. Bye.